If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask.
WHO advises that governments should encourage the general public to wear masks where there is widespread transmission, as symptomatic people can transmit COVID-19.
It still appears to be rare that an asymptomatic individual actually transmits onward.
At this time, there is no evidence of human-to-human transmission outside China. The human-to-human transmission in 3 countries worries us: in Germany, in Vietnam, and also Japan. I will praise China again and again because its actions actually helped in reducing the spread of coronavirus to other countries.
Despite the first cases of an unknown but deadly flu being reported in December 2019 in Wuhan, China, life was pretty much going on as usual until March 11th, 2020. It was on this day that the World Health Organization finally declared the coronavirus outbreak a pandemic.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
By then, about 1,000 cases had been reported in the United States, and 29 people had died in the country due to the Wuhan virus. On the same day, the National Basketball Association suspended its season after 2 of its players tested positive with COVID-19. This was also the day when Hollywood's disgraced mogul Harvey Weinstein was sentenced to 23 years in prison for rape and sex assault in a case that sparked the Me Too movement. But no news mattered more than this. A pandemic was set to change the world forever. On Wall Street, the Dow Jones Industrial Average fell 1,465 points and officially entered bear territory. The US slowdown turned into a full-blown shutdown. A few hours later, Oscar-winning actor Tom Hanks and his wife Rita Wilson tested positive for the virus in Australia. Just after the pandemic announcement, India suspended all visas except a few categories such as diplomatic and employment till April 15 to prevent the spread of the virus. By March 12th, 10 new cases were reported in India, taking the total number of patients in the country to 60. In all the 18 affected countries, panic was setting in. A battle between the human race and the coronavirus was in full swing. Terms like lockdown, work from home, personal protective equipment, flattening the curve, social distancing, self-isolation and quarantine became all too common. 1 year down the line, life has changed dramatically for all of us. By March 11, 2021, more than 117 million people have been infected by the Wuhan virus, and the virus has claimed the lives of 2,600,000 plus people. Who is to be blamed for this? Ever since the outbreak was first detected, WION has been asking the tough questions.
The history of this pandemic will have one name in bold letters: Tedros Adhanom Ghebreyesus. It's been a while since we heard from the World Health Organization, a body which, in its attempt to please China, left the world unprepared to deal with this pandemic.
Why is the world not holding China accountable for its lack of transparency? Why did the World Health Organization fail to act quickly at the onset of the outbreak, waiting until January 30th, 2020, to declare a global emergency? The early evidence of human-to-human transmission was completely ignored by the WHO, plunging the world into an unprecedented emergency. The White House, too, accused the WHO of severely mismanaging the crisis and helping China cover up. The United Nations body responsible for international public health has clearly failed at controlling the infectious disease outbreak. It has been 365 days since the WHO lost its credibility. Can we ever trust them again?
This week we will reach 20 million registered cases of COVID-19 and 750,000 deaths. Tomorrow marks 6 months since WHO received the first reports of a cluster of cases of pneumonia of unknown cause in China. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level.
If you have been following coronavirus developments, then you would be familiar with this person. Meet the first non-medical doctor to lead the WHO, Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization. Tedros has been overseeing the world's management of the COVID-19 pandemic, and he is the man responsible for the organization's mishandling of the crisis. Even his credentials are being questioned.
Health emergencies.
His close relations with China came under the scanner in January 2020 when he met President Xi Jinping of the People's Republic of China to discuss the outbreak. On January 23rd, the World Health Organization declined to designate the ongoing outbreak of a novel virus in China a global health emergency.
Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency.
And the world believed him. A week later, the WHO declared the COVID-19 outbreak a public health emergency of international concern. But Tedros stated there was no cause to limit trade or travel with China, and even went on to defend the country, saying that governments across the world should adopt policies to prevent the spread of the disease that were evidence-based and not unnecessarily interfere with international travel and trade.
There is no reason for measures that unnecessarily interfere with international travel and trade.
On March 11, 2020, the WHO was finally forced to declare COVID-19 a pandemic. warning that the virus could reach other countries in no time. He repeatedly praised China for its containment measures, but it was too little, too late.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
China's lack of transparency and the WHO's mishandling of outbreak in those early critical days resulted in an uncontrolled spread of the deadly virus. Within months, 219 countries and territories were affected by it.
China is bringing its epidemic under control, and there is now a decline in new cases being reported.
Coronavirus cases exploded in Italy, the United States, the United Kingdom, and Europe. There was no stopping it. Many government officials and public health experts were pointing their fingers at Tedros, and rightfully so. By mid-April, former US President Trump threatened to cut US funding to the WHO, saying the agency had failed in its basic duty in its response to the coronavirus outbreak.
For many years, hundreds of millions of dollars has been paid to the World Health Organization, hundreds of millions of dollars a year.
Tedros responded by asking for the virus not to be politicized and calling for unity in fighting a common enemy.
The focus of all political parties should be to save their people. Please don't politicize this virus.
In April 2020, a bipartisan US House committee demanded his resignation. They also asked for an international investigation into the organization's role in covering up the Chinese Communist Party's failed COVID-19 response. Responding to the criticism, the WHO chief alleged that he was being subjected to racist comments. Tedros is the first African head of the WHO. He said the abuse had originated from Taiwan and accused the country's leaders of spearheading personal attacks against him. These allegations were vehemently denied by Taiwan. It is noteworthy that China's Communist Party regards Taiwan as a breakaway province and has vowed to one day seize the island. Taiwan is not a member of the United Nations or its sub-organizations, such as the WHO, though its response to the coronavirus is among the best globally. The World Health Organization was established in 1948 to further international cooperation for improved public health conditions. Like other United Nations agencies, it is funded by member states and private contributors like the Bill and Melinda Gates Foundation. The US is one of the largest donors to the WHO. With recovery of Jews at an all-time low, it also relies on Chinese largesse. In April 2020, China pledged an additional $30 million funding for the agency. Over the years, the WHO has been praised for the way it has led the fight against diseases like smallpox, tuberculosis, measles, and polio. But now the organization is facing a crisis of credibility. What went wrong? Dr. Tedros, as he likes to be called, was elected as WHO Director General for a 5-year term by member states at the 70th World Health Assembly in May 2017. Born in 1965, he grew up in northern Ethiopia's Tigray region. He became a member of the Tigray People's Liberation Front and joined the Ethiopian Health Ministry, rising through the ranks to become the country's health minister in 2005. From then till 2012, he was accused of covering up 3 cholera epidemics in his country and endangering surrounding states. In his defense, Tedros claimed that cholera outbreaks were only acute watery diarrhea, and they were limited to remote areas of the country where laboratory testing was difficult, and that international concerns were overblown. The epidemics eventually reached neighboring countries like Kenya, Somalia, and Sudan. It was even reported that WHO officials complained privately that Ethiopian officials were not telling the truth about those outbreaks. So why did the WHO appoint him to the top job? Perhaps the answer lies with China. Tedros served as the Minister of Foreign Affairs of Ethiopia, one of the world's most oppressive regimes, from 2012 to 2016. It was during this time that China invested in the African nation and signed multiple deals worth billions of dollars. Between 2000 and 2014, China provided over $12 billion in loan finance to the country, and this is just one part of China's link. How did he become the WHO Director General? This appointment is made through an election. And Tedros ran a successful campaign to get the job. He had powerful backers, no prizes for guessing who. The Chinese were backing him from the start. Beijing voted in his favor. They even helped him whip the votes. Soon after he was appointed chief, he came under fire for selected Zimbabwean President Robert Mugabe as his goodwill ambassador. Mugabe has long been criticized for corruption and abuse of power. Even the strongest supporters of Tedros were taken aback by this decision. It attracted a chorus of criticism from all quarters. Following the outrage, Mugabe was removed. But several former and current WHO staff said privately that they were appalled at Tedros' poor judgment and miscalculation. These two things would come back to haunt the world. Could this pandemic have been averted if someone more able was steering the ship? On August 12th, 2020, World Health Organization launched a Wear a Mask challenge.
Today, WHO is launching our new Wear a Mask challenge, and I'm urging you all to keep wearing a mask that covers your nose, mouth and chin.
WHO Director General Tedros Adhanom too encouraged people to wear a mask by indulging in the challenge himself.
Wearing a mask.
A unique way to reach out to people, isn't it? Well, not really. After their multiple confusing statements and misunderstandings about the entire mask issue, WHO desperately needed to do some damage control. And what better than an internet challenge?
We're the ones that can end this pandemic. So wear a mask, do it all, save lives.
Just days after the pandemic was announced, the World Health Organization advised that medical face masks should only be worn by people who are sick and by those caring for them. This was in March 2020. June 2020, when the number of cases was rising exponentially, the World Health Organization changed its guidelines on face masks.
In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments.
Just a few days after making these masks mandatory, the organization once again came under fire for yet another misunderstood statement. In a daily press briefing, WHO technical lead Maria van Kerkhove said that coronavirus patients without symptoms aren't driving the spread of the virus.
It still appears to be rare that an asymptomatic individual actually transmits onward.
These statements led to an international outcry among other scientists and health experts who had been saying the exact opposite. Though the health institution retracted their statement and tried to clarify the misunderstanding, the damage was already done. Dr. Anthony Fauci, the US government's top infectious disease expert, had to intervene, saying that WHO had to backtrack on its statement about the asymptomatic spread of the coronavirus being rare, because that simply was not correct. Almost every statement that the WHO made in the early months of the pandemic has been proven to be incorrect, and it is not surprising that health experts and scientists are doubting its credibility. Opposing flight restrictions and travel bans, erroneously endorsing the Chinese government claim that there was no clear evidence of human-to-human transmission, skepticism that asymptomatic patients could transmit COVID-19, and even questioning the effectiveness of healthy people wearing masks. Many loopholes have been identified in WHO's functionality and performance during the coronavirus pandemic. February 9th, 2021. A joint WHO and China team probing the origins of COVID-19 in Wuhan wrapped up their investigation. "17 Chinese and 10 international experts ended their visit to Wuhan, the origin city of COVID-19. They spent 4 weeks in China for an investigation that was delayed for almost a year. And guess what did they find? Nothing much. The investigators concluded that the coronavirus is more likely to have jumped to humans from an animal, and that bats remain a likely source, but from an unknown location, dismissing all initial reports that stated it originated from the Wuhan seafood market. The team findings were based on their visit to the controversial Wuhan seafood market. The intermediate animal that passed the virus from bats to people has not been identified. But researchers think it might be a wild species that is sold as food in unhygienic wet markets, which typically sell live animals. The experts also all but dismissed a theory that the virus came from a laboratory in China. The WHO-led mission was tightly controlled and stage-managed by China.
Any expectations?
The scientists even visited a propaganda museum, celebrating Wuhan's fight against COVID. Unfortunately, none of the questions about when, where, and how the pandemic began have been answered. So, was this probe a whitewash, a mere formality? In April 2020, China rejected calls for an independent international investigation into the origin of the coronavirus, calling it an unwelcome distraction. Perhaps a timely investigation would have yielded more conclusive results. Did the World Health Organization give ample time to China to remove all possible evidence? Why did Beijing repeatedly delay this probe despite international pressure? China had closely watched the visit by the WHO, with Beijing concerned about being blamed for missteps in its early response to the pandemic. On February 13, 2021, the White House called on China to make available data from the earliest days of the COVID-19 outbreak, saying it has deep concerns about the way the findings of the World Health Organization's COVID-19 report were communicated. But China is doing all it can to deflect blame for the pandemic and curtailing any mentions of Wuhan as the origin of the virus. Meanwhile, despite vaccines being rolled out, the Wuhan virus continues to take a toll, and the World Health Organization continues its deference to Beijing. So, who should we hold accountable?